National Healthcare Decisions Day is a day for us all to think about what matters most to us as people. And if, God forbid, we were to become seriously ill, what kind of care we would receive. I think what is important is that we can think about what matters most to us as an individual and the qualities or abilities that make us who we are. For example, someone might say, I'm a mother, and being able to parent my kids, being able to talk with them about their day and what's going on at school, that defines who I am. That's what matters most to me. So that's the type of thing that it's important for people to think about when they think about healthcare. Because if a treatment would allow you to still be that person, to still do those things, it makes sense for you. If a treatment doesn't allow you to do those things, perhaps it wouldn't. It's such a hard thing to really start these conversations because I think for many of us, we worry, what does it mean if I'm starting to talk about what if things don't go the way that I hoped? So I think it's really helpful if you have something that you can kind of hold on to, a checklist per se, or a tool. There are tools available. The Conversation Project, which is at a website, theconversationproject.org, has a wonderful tool that really helps you start thinking about what kind of care you would want. Are you someone who wants to be involved making all the decisions, or are you someone you want your doctors to make decisions for you? It helps you think about which one of your family members might be the best healthcare proxy, the best person to speak for you if you couldn't speak for yourself. For our patients living with cancer, again, many of them will go on to live long, long, healthy lives. And the unexpected can affect anyone. So I think sitting down and thinking a little bit about who would speak for you and what kind of care you would want if the unexpected happens makes a lot of sense. So I think this is something that everyone should do. And when any of us is struck with a serious illness, then it becomes even more important.